Hi, today let's discuss the arterial blood supply and the venous drainage of the digestive system in simplified, well-organized steps. Before we proceed, please don't forget to like the video, to leave a comment behind, to subscribe to my channel, and to share with those that might benefit. The GIT derives most of its supply from three main branches of the aorta. The celiac trunk or the celiac artery supplies the structures of the foregut. The superior mesenteric artery supplies the structures of the midgut, and the inferior mesenteric artery supplies structures of the hindgut. The rectum and the anal canal derive part of their supply from branches of the internal iliac artery and the median sacral artery. The veins of the GIT follow a similar branching, but drain into the hepatic portal vein and not the inferior vena cava. The celiac trunk has three main branches: the common hepatic artery, the left gastric artery, and the splenic artery. The superior mesenteric artery branches into several branches: the inferior pancreato-duodenal artery, the middle colic artery, several jejunal and ilio arteries, left colic artery, and the iliocolic artery. The inferior mesenteric artery gives off three main branches. The terminal branch is the superior rectal artery. We also have the right colic artery and the sigmoid arteries. Before we talk about these branches in more detail, please note that the blood vessels of the GIT run either in the mesentery for intraperitoneal organs or between the parietoperitoneum and the posterior abdominal wall for retroperitoneal organs. Here the peritoneum is drawn in green. The celiac trunk branches from the aorta just inferior to the aortic hiatus of the diaphragm. Here the aorta is dotted red. The diaphragmatic fibers are the purple strips. Let's look at the branches of the celiac trunk once again before we go on to look at the blood supply of each organ. The two terminal branches are the splenic artery and the common hepatic artery. Here is the hepatic artery proper. Here is the left gastric artery, and here is the right gastric artery, and lastly the gastroduodenal artery. In the abdomen, the esophagus is supplied by the esophageal branch of the left gastric artery. In the neck, it is supplied by the inferior thyroid artery, and in the thorax, it is supplied by the bronchial arteries, the esophageal branches of the aorta, and the inferior phrenic arteries. The right gastric artery, which branches from the common hepatic artery, and the left gastric artery, which branches directly from the celiac trunk, form a loop that supply the stomach wall along the lesser curvature. The splenic artery passes in the lateral direction beneath and posterior to the stomach wall to give the splenic branches and the short gastric arteries, which supply the fundus of the stomach. On the left side, the splenic artery gives off a branch that is known as the left gastro-omental artery or the left gastroepiploic artery. On the right side, the gastroduodenal artery, which is a branch of the common hepatic artery, gives off a branch which is known as the right gastro-omental or gastroepiploic artery. These two form a loop along the greater curvature of the stomach and supply both the stomach wall and the greater omentum. From the common hepatic artery also branches the supraduodenal artery, which supplies the first part of the duodenum. The blood supply to the pancreas and duodenum comes from the superior and inferior pancreato-duodenal arteries. The superior pancreato-duodenal arteries are branches of the gastroduodenal artery. Here are the posterior and anterior superior pancreato-duodenal arteries. The inferior pancreato-duodenal artery is a branch of the superior mesenteric artery. The pancreas also receives blood from branches of the splenic artery like the dorsal-pancreatic artery, which branches into the inferior pancreatic artery, and the anastomotic branch. The other branch is the great pancreatic artery. The superior mesenteric artery gives off several branches. Here are the jejunal arteries, which supply the jejunum. Here are the ilio-arteries which supply the ileum. Here is the inferior pancreato-duodenal artery which supplies the pancreas and the duodenum. Here is the middle colic artery which supplies part of the transverse colon. Here is the right colic artery which supplies part of the ascending colon. Here is the iliocolic artery which supplies the cecum, vermiform appendix, and part of the ascending colon. The jejunal and ilio arteries form a network of anastomotic loops, also known as the arterial arcades. The arteries of the colon form the marginal artery. From this branch the straight arteries, also known as the arteriae recti. The iliocolic artery gives off the appendicular artery, which supplies the vermiform appendix. It also gives off the anterior cecal artery and the posterior cecal artery, which supply the cecum. Before we talk about the inferior mesenteric artery, let's illustrate a branch of the superior mesenteric artery which we didn't talk about earlier, the middle colic artery. Also remember that the marginal artery runs along the entire length of the large bowel. So, here is our inferior mesenteric artery. It gives off the right colic artery, which has the ascending and descending branches. Here are the sigmoid arteries which supply the sigmoid colon. The terminal branch is the superior rectal artery. Here is the median sacral artery which branches directly from the aorta to supply the superior part of the rectum posteriorly. The common iliac artery branches into the external and internal iliac artery. From the internal iliac artery branches the middle rectal artery. The inferior rectal artery is a branch of the internal pudendal artery, which is a branch of the internal iliac artery. The inferior rectal artery is also known as the inferior anorectal artery or the inferior hemorrhoidal artery. The veins of the GIT correspond to the arteries. Here are the short gastric veins, and here is the left gastro-omental vein. These two drain into the splenic vein. The inferior mesenteric vein drains into the splenic vein, whereas the superior mesenteric vein joins with the splenic vein to form the hepatic portal vein. Here are the posterior inferior, anterior inferior pancreato-duodenal veins, while here are the posterior superior and the anterior superior pancreato-duodenal veins. Here is the left gastric vein, and here is the right gastric vein. Here is the prepyloric vein, and here is the hepatic portal vein, and this is the right hepatic vein. Thank you very much for watching. Please like, comment, subscribe and share. Feel free to ask questions or to request for particular videos.